video will explain primary IV administration. First, assemble your equipment.
I have my IV fluids, my primary tubing, my alcohol, my labels, my tape, my pen, and my gloves.
The physician's order for IV fluids to be given.
Okay, I see that Mr. Daniels is due for another bag of fluids.
Compare the medication administration record, or MAR, to the physician's order for IV fluids to be given.
Okay, everything's been checked.
Wash your hands. Take vital signs as necessary. For example, you would take a blood pressure if you were going to give a blood pressure medication.
Check the IV bag for expiration date, leakage, and correct fluids.
Well, it looks like this is not expired and this is the correct fluids.
Prepare labels for IV fluid bag and primary tubing.
Alright, these are the labels for Mr. Daniels. This was the one that's going on his fluids, and this is the one that's going on his tubing.
Place correct label on IV fluid bag.
Nurse, my IV bag is almost empty.
I know, Mr. Daniels. I'm working as fast as I can.
Okay.
Time strip primary IV fluid bag with tape to coincide with fluid volume to be infused.
Right, so 100 per hour.
Tubing and close the roller clamp.
And make sure I close this clamp.
Protective cover from the spike. Attach tubing to the primary IV bag. Squeeze drip chamber until half full. Open clamp. Prime tubing to clear tubing of air without losing medication. At the bedside, maintain appropriate communication. Use proper body mechanics. Identify the patient.
Nurse, what is your name again?
My name is Vikita. How you doing?
I'm awfully tired. I hope I get to go home soon.
Oh, I understand. What's your name?
My name is Mr. Jack Daniels.
And what's your date of birth?
May 12, 1978.
Do you have any allergies?
No, not that I know of.
To any medication or to latex?
No, I'm pretty healthy other than being here in this hospital this time.
Okay. Well, we're about to start your fluids in a second, okay?
Explain the procedure to client. Don gloves.
What I'm going to do is change your IV bag. This one is kind of empty, and I'm going to give you a fresh bag that's full of fluids. It has a liter in there. I'm going to check your IV site, and I'm going to hook this up to your IV site.
Okay.
I'm going to put on my gloves.
Will it take very long?
No more than a couple of minutes.
Okay.
IV site for infiltration or phlebitis.
Mr. Daniels, do you have any pain at this IV site?
No, it feels pretty good today.
I don't see any redness, no swelling, no color change. I don't feel no heat at the site. So I'm going to go ahead and use this IV site. I do not even see any bleeding at the site, so this is a great site. We're going to use this one again, okay?
That sounds good to me. Thanks.
System for intactness. Hang primary fluid.
I do see there's no kinks here. and that I have your labels on. So I'm gonna go ahead and hang this set on you, okay?
Okay, that sounds good.
After cleaning INT with antiseptic solution, attach tubing to client's IV site.
I've just used some alcohol at your IV site tubing, and I'm going to connect you now. You're now connected.
Okay, how fast will that IV run today?
It's going to go pretty fast. We still want to hydrate you.
Okay.
Regulate flow rate to within plus or minus 4 drops a minute.
Okay, Mr. Daniels, I have everything hooked up now and you're running fine. I'm going to come back and check on you in about 30 minutes. If I come in, if you have any pain before that time, you come and you ring your call button. That's right here on your rail here, okay?
Okay, I'll make sure to do that.
Is there anything else I can get for you?
No, I'm pretty comfortable. I think I'll just take a rest now.
All right, I'll be back in about 30 minutes.
Thank you.
You're
When you
welcome.
have finished, take off your gloves, wash your hands, document on the patient's chart and MAR.